Addressing issues of mental health and trauma can take the back burner in a classroom when teachers only have so much time with students. This weekend, some area educators are becoming the students themselves and learning how to tackle these important topics. Reporter Mal Meyer dropped by the University of La Crosse to catch some of the attendees in between classes. Mal?
Sarah, the 20th Annual Fall for Education Conference brings those working with children from preschool through 12th grade to campus from around the state. The different breakout sessions are helping the attendees better understand, address, and prevent the problems that many young people face. While the conference organized by the UWL Institute for Professional Studies and Education has touched upon mental health and trauma in the past, it hasn't been quite as in-depth.
Mental health and trauma is a huge issue, not only here in La Crosse in the area in Wisconsin, but throughout the country.
Despite the prevalence, MARKOS says that not all teachers have the training to identify and tackle these issues.
You can't really teach academics effectively unless you have a handle on what's going on in their life.
It starts with identifying the source of the suffering.
We are alive, we strive, and we thrive.
In her breakout group, Barbara BLACKDEER-MACKENZIE explains how colonization and forced relocation have led to historical trauma in indigenous populations.
There's a genetic as well as a social thing that goes on in terms of passing along the pain, anxiety, depression.
Part of resolving these issues is helping giving a voice to the suffering.
I don't think we're listening to kids enough when they try to tell their stories, and they don't always tell them verbally.
CHERYL BARTKY knows this well as a counselor and dance therapist. She led a session about using movement to understand trauma.
It's also a pivotal way to help students move through, literally to move through some of their trauma.
Researchers with the Center for Disease Control and Prevention and Kaiser Permanente have found a correlation between childhood traumatic events and an increased risk for certain diseases later in life, which is why learning how to approach trauma is so important.
A lot of my content while I'm talking to educators is for all of us. This is all of us as a community need to be working on doing our role to support healthy families.
Organizers hope that when educators return to the classroom on Monday morning, that they will have some strategies that they can use immediately with their kids. Sarah?
Thanks, Mel. While the topic of next year's conference has not been finalized, organizers with the university hope to continue the discussion surrounding mental health and trauma.